So today we're discussing humor therapy, and the main focus is how laughs save lives, improving the physical, mental, and all-around health of pediatric or children patients specifically within the healthcare setting. So there are many negatives to, well, negative health, negative symptoms, negative conditions such as stress, sadness, and what the effects on health are is, well, if someone is sad, they will experience more tiredness. If they are stressed, they will not have the same reaction and mental capacity, so they can appear weaker or not as able as they normally are. If someone is experiencing a discombobulation or confusion, or they just don't really have their head on right, they will not be able to focus or they will not be able to sleep if they're worrying about things that could be occurring in the future or what occurred in the past. And especially in the sense of children in the hospital, they don't know what's going on. They don't know what is in the beeping, and the environment is new to them, and they obviously are not comfortable, or they likely will not be. They can experience depression as well because they are not able to be out, be enjoying the sun, be doing what they normally do. And this depression or sadness is obviously a negative on their health. And this can all coalesce, or simpler, this can all combine to hurt their chances and increase the likelihood of negative repercussions related to treatment. So, the importance of happiness in health is that someone who is happy is stronger. They will live longer, and that's the main purpose of this is we want these people to be stronger and healthier while getting treated. They will have less stress as long as they're happy, and humor is one of the best ways people do feel happier. They laugh and smile, and they enjoy the environment more when they feel more comfortable in said environment. And as well, they are smarter, so they aren't thinking irrationally or like rushing to conclusions. And especially and one of the most important is they get better sleep, so they're not sleep deprived. They're not experiencing all the negatives of that condition. And one of the most important parts is, even if it's not entirely, they don't entirely have the feeling, having a at least adjacent feeling of love in the air, or just a happiness that is associated with love, can make them have a more important reason to push through and have a reason to keep on fighting, especially in cases of more extreme treatments. When kids are when kids are happier, well, care is easier and it's more efficient. And maybe one of the most important parts is they are healthier, and doctors and physicians can focus, as well nurses, can focus just on treating the children rather than worrying about all these extra components that aren't, well, simply treatable. You can't make someone happy, or you can't make someone stronger, but you can obviously put forth efforts that improve their chances in small categorical measures to improve those criteria.
So, what was done to test this idea of happiness leading to better health? Data was collected from a children's section of a hospital for 9 months. The children in this hospital ward were given humor therapy, which was where professionals trained in comedy came to the hospital and performed characters for the children. During this time period, the children took tests to see how much pain or stress they were in, and they were taken before and after the children were given the humor therapy. The overall goal of this experiment was to see if humor therapy helped patients feel better, and if that worked, the data from the test would show lower pain and lower stress after the therapy. So, the specific test that they took, the first test was the spit test. And in the spit test, the children used a cotton ball to gather some of their spit, which was taken to a lab for testing. And what was tested was the amount of our particular hormone or chemical called cortisol. And cortisol comes from the body and is released when someone is in pain or is experiencing stress. So, less cortisol means less pain. The second test was the caretaker test, also known as the Parker's test. Each child patient's caretaker, which could be a nurse or hospital staff member, answered questions about the child's behavior and mood. In this test, higher scores meant higher stress and pain. The third and final test that the children took was the patient picture test, also known as the WISE test. Each child was given the range of faces on the right to represent different emotions. They picked the face that was closest to how they were feeling. And as you can see from the numbers underneath the faces, a higher score on this test meant less stress and pain.
Here are the results from group one, in which there was two experimental groups. One group received the experimental treatment, which was the humor therapy, and one group served as control. As you can see in graph A, the cortisol levels of the intervention group was significantly lower than the non-intervention group. Graph B shows the results of the WISE test scores, and the intervention group's score is significantly higher than the non-intervention group's score. And then finally, graph C shows the Parker test results, in which the intervention group's results were significantly lower than the non-intervention group. Here's the results from group two, in which these tests were taken before the humor therapy treatment, and then the tests were taken after the humor therapy treatment. Graph A shows that the cortisol levels were significantly lower after the intervention treatment compared to before. And graph B shows that the cortisol levels or the WISE test scores were significantly higher after the treatment than before. In summary, both intervention groups had significantly lower cortisol levels. The Parker test showed that the intervention group in group one had a lower average assessment than the non-intervention group. And in both intervention groups, the WISE test scores were higher than average than the control groups.
So, next question you may be asking is, what does this mean? Suggested from the data, humor therapy would reduce stress levels, make patients happier and healthier in appearance, and increase self-reported well-being. Since, as we mentioned before, cortisol is the stress hormone, by measuring it, we can efficiently measure stress levels. Less cortisol implies less stress. Now, the Parker test is a test filled out by the child's caregiver who takes note of their mental and physical appearance. While looks aren't everything, it is important to take their account into hand because they're trained to diagnose issues and notice issues, especially in the pediatric field, where words can't always describe what's wrong. But if you look at something like the WISE test, pictures may be able to help describe what's wrong. And in the case of our study, pictures prove that less was wrong, or they were feeling better oftentimes after humor therapy due to the self-reported imaging of emotions and happiness. Now, there are possible limitations to this study due to subjective personal bias or interpretations. While one doctor may look at the same patient and diagnose him or score him a little bit differently than another, overall, it's not going to be a giant fluctuation because for the most part, they're trained the same and have the same goals in mind. Another limitation could be the limited span of emotional representation. The only self-reported emotion that we had recorded from the children was their WISE test. And that's only going to record their emotions right at that moment. It won't represent how they feel after or how long the effects last or how it changed over time. But fortunately, that's the cortisol is supposed to help with.
So, what can we do with this information going forward? One thing we could do would be to repeat this experiment with adult patients. Because this experiment only looked at data from children, we don't actually know how adults might respond to the same humor therapy. So we could try it again. And additionally, the humor therapy in this experiment did show positive results, which means it could be useful for implementing in hospitals. When kids are sick, it can be really difficult for both them and their families. And if humor therapy could help make them feel a little happier and make their time at the hospital a little better, it might be worth looking into and starting to implement.
This research was conducted by Sanchez and his team. And thank you for attending our presentation. That's all.